Dr. Josh Windmiller. So advance your slide.
Thank you, Tim. Good morning, everyone. How are you? Good. I mean, for those of you West Coasters, it's still early, I understand, but for those of you from the East Coast, you should be a little louder. How are you this morning? Good, good. All right, it's my pleasure to introduce you to the future of wearable sensing here. Could you please cue the video?
Say hello to the amazing new Dexcom G7, a continuous glucose monitoring system that's made for you, so you can manage your diabetes with confidence. See your glucose numbers on your watch and phone. Get meaningful insights into how food and exercise affect your glucose in the moment, without fingersticks or scanning. Dexcom G7 is so small, it's easy to forget you're wearing it. So even when your mind is elsewhere, it's continuously sending glucose numbers that you can be confident in. Because Dexcom G7 is the most accurate CGM system. That's right, the most accurate CGM system. Hear that? That's your Dexcom G7 alerting you before you go too low. Phew, that's a relief. And you can personalize your alerts too. Quiet, loud, yeah, totally up to you. And if your loved one has diabetes, you can see their glucose numbers on your phone using the Follow app. Now that's peace of mind. Dexcom G7 is easy to apply, easy to set up, and even easier to use. It warms up 2 times faster than any other CGM system, so you'll have more time with your numbers. It shows where your glucose is at, where it's heading, and where it's been. It also shows your progress, all on one screen. And let's say your sensor expires when you're out and about. Well, thanks to the new 12-hour grace period, you can swap sensors when it's convenient for you. And most importantly, Dexcom G7 is made for results. Using Dexcom CGM can help you spend more time in range, which can lead to lower A1C. So you can do more of what you love. Dexcom G7 is made for more, so you can manage your diabetes with confidence.
Excellent, how's that? Pretty cool, huh? My disclosures, I am an employee of Dexcom. So the topic for my discussion this morning is enabling human health. And I'd like to share a story actually that just happened yesterday when I was on the plane flight over here from San Diego. I was actually wearing some Dexcom branded attire, and a lady sat next to me and asked if I use a Dexcom. And I said, well, I do not have diabetes, but I actually lead innovation programs at Dexcom. And she actually told me her son was a type 1. He was diagnosed when he was the age of 2. And every night she had to wake up and stick his finger to check if he didn't go dangerously low. And she, as a parent, could not get a single full night of sleep when he was young. Fortunately, she found Dexcom about a decade ago, put her son on one of the systems back then, our G4, and actually was able to get a full night of sleep because the CGM would do her job for her, continuously monitoring her son throughout the night. And she actually asked for my phone number. And believe it or not, her son, now this young man, actually called me this morning and just said how transformative a Dexcom was for him. He could go back to living his life as a kid and a young man, going out to the movies with his friends, going to the beach with his friends, just doing things that adolescents do. So that really embodies what we're all about at Dexcom. Dexcom has had significant growth over the past decade. Actually, over the past decade, we've been one of NASDAQ's leading growth companies. We're on track this year for over $3 billion in revenue. And we've grown our user base by about 35% during 2022. It's remarkable growth. We're now serving over 1.5 million people globally. We're driving expanded access among caregivers, and we've actually launched our latest generation G7 product here in the US earlier this year. We have a quite high gross margin and operating margin, and we expect our growth to continue as more folks who are insulin dependent gain awareness for our system. So diabetes is the epidemic before the pandemic, but it continues to be an epidemic at the present time. You can see that over 500 million people globally are afflicted with diabetes. That could either be type 1, where your pancreas has lost the ability to produce insulin, could be type 2, where you may still be producing insulin, but your cells become more resistant to it. Could also be gestational diabetes, as well as some other forms. Diabetes health-related medical expenditures, indirect or direct, are responsible for this year over $1 trillion in economic burden. Over the past 2 years, that's roughly a 27% increase, so growing considerably. Now let's look at someone who has type 1 and who finger sticks throughout the day. Type 1s on average will tend to finger stick a few times a day, let's call it 4. And let's say when you wake up, you notice you're low. So what do? You ingest carbohydrates, you go get your breakfast, and suddenly before lunch, you notice that your glucose levels have spiked to quite high levels. So what do? You'll probably treat with insulin and monitor it, and you might take another finger stick around dinner time and see that while still high, you're trending lower. So what do? Before you go to bed, you take a confirmatory finger stick to see that you're in range, and lo and behold, you are. But this is truly not enough, because this is more like what it looks like throughout the day if you have type 1, where if you wake up low, you've had a night where your glucose levels have dipped precariously low. If I am driving a car and I see my glucose levels at 50 milligram per deciliter, I'm turning over and stopping because I'm at risk of passing out. Likewise, you can see how this patient had a significant amount of time in hyperglycemia and probably should have dosed earlier. Now let's look at someone who has type 2. You might only finger stick once a day. And what does your finger stick tell you? Tells you you're actually in range, when in fact, you're anything but. For the majority of your time, you are in hyperglycemia, which has long-term complications like neuropathies, retinopathy, and also some comorbidities like kidney disease and cardiovascular disease. So our premise is we can do more. So we have created the new leading product in CGM, the G7. It is a real-time CGM that delivers information directly to your smartphone or your smartwatch, so you can see where you've been, where you are, and where you're going. The system is fully disposable and very simple application, comprising only 3 steps. You twist off the cap, you press it against your skin, and you push a button to deploy. That's it. This has a 30-minute warm-up. So the clock is ticking down. In 30 minutes, I can have a real-time reading delivered directly to my smartphone. It's the only iCGM trusted for use in gestational diabetes during pregnancy. It provides users with very personalized insights, and it can directly present data to a wearable of your choice. No more finger sticks. I do not need to calibrate my CGM based on finger sticks. So I am set now for 10 days. What are customers telling us? Our customers are giving us raving reviews. They almost called an unwearable, where they forgot it was there, and they find value in managing their glucose levels day to day using the device. 97% of them actually find our product very easy to use. So what's next for us? We are quickly rolling out in international markets. We are in many markets in the EU, and we're expanding in other continents. Also, we're growing as far as how CGM gets to you, either through durable medical equipment providers, streamlining fulfillment there, through Medicare, and through the pharmacy benefits channel. So if you walk into a pharmacy and you have a prescription for Dexcom, you can get it. We're also expanding our connectivity with paired devices, smartwatches, and other wearable technology. Now, one of the remarkable things that has happened just a couple months ago is a new CMS ruling that traditionally CGM was only reimbursed for patients who were intensively insulin managed, those who would inject themselves multiple times a day or would wear an insulin pump. What CMS did is they opened up reimbursement to anyone on insulin. So those who might inject once a day or once a week, those who are on basal insulin, effectively doubled our addressable market overnight. So we expect continued growth because of this new ruling and expanded reimbursement for CGM. We've made it very simple for caregivers, physicians to prescribe, and we've expanded customer access, making it easier than ever to acquire CGM. And we've actually earned this distinction of being the #1 covered and most reimbursed CGM on the market today. So commercial execution. We have had a few strategic imperatives at Dexcom that have really driven our evidence generation. We've shown through our mobile study that patient empowerment is truly the thing that is needed to help enhance outcomes. We've doubled the size of our sales force in this past year, and we've actually introduced a sampling program for people who are new to CGM, who are considering it, but not quite sure if it's right for them. We've also doubled our primary care prescriber base, and we've actually doubled our monthly new patients starting in primary care. Traditionally, CGM was something that was only prescribed by the endocrinologist, the medical specialist, but we see further growth in expanding access to primary care. As I discussed, we're entering new geographies and new markets, really expanding our footprint internationally, reducing administrative barriers. So again, making it easier than ever to acquire CGM and also to get CGM reimbursed, whether it be domestically or internationally. And so we feel that much of our driver in the ensuing years will actually be from outside of the US sales. Now, historically, Dexcom has been a single product company. That has recently changed. Our G7, our industry-leading platform, is intended for broadly reimbursed markets. We've also created a G series variant, both based on our G6 and our G7, to tackle markets with tiered reimbursement where the technology might only be partially reimbursed. Dexcom ONE is also available as a cost-efficient solution in markets where they may be cash pay, so the user actually has to pay to acquire CGM. We've given access to over 3.5 million additional people with diabetes over the 18 months, given our international launch strategy, and that is looking at both G7 and our Dexcom ONE solution. So our premise for expanding into the type 2 market, again, folks who may not be intensively insulin managed, are to drive user engagement, maximize health outcomes, and maximize the ROI for payers. And we've done that through sponsoring a number of clinical studies like our mobile study, which has stated that patient engagement is the key to maximizing time in range, which itself is the necessary component to reducing comorbidities of diabetes. We've actually shown that not only does wearing CGM help reduce comorbidities, that the cardiac and metabolic outcomes of wearing CGM actually improve versus those who are finger sticking on a daily basis. And this actually has significant implications for payers who can actually see savings generated because of that. We see connectivity as a competitive advantage. So we have been partnered for a number of years with folks making insulin pumps. And the recent emergence of automated insulin delivery is a significant growth driver in our type 1 market. So folks like Tandem and Insulet have partnered with us to power their insulin delivery systems. And now with AID, folks don't necessarily have to titrate insulin. They can actually use the system in a closed loop and have the system titrate insulin in response to their glycemic load. For those who prefer to manage diabetes with pens, we've worked over the past few years with Lilly and Novo on connected pens using Bluetooth, and with many of the digital health and smartwatch manufacturers like Garmin to create new digital health apps to display glucose data in real time. One of the most beloved aspects of our platform is called Dexcom Share and Dexcom Follow. Dexcom Follow allows caregivers the ability to see their children's glucose in real time, or let's say you're looking at the opposite end of your spectrum and you have a parent who's elderly who needs to manage insulin. You can actually track their blood glucose levels in real time remotely via your smartphone. And we've also provided healthcare providers with our Clarity Clinic, which allows physicians a very intuitive assessment to understand how glucose excursions change over time. So empowering people to take control of our health is our long view mission. Today, we've been primarily focused on the intensively insulin and basal only market, folks, again, who have to use insulin to treat their diabetes. Where do we see the future going? Well, we see the future going in comorbidities of diabetes, adjacencies of diabetes, and even chronic healthcare opportunities outside diabetes. So this includes folks who are not on insulin, who have type 2, who might be on oral medications like metformin or sulfonylureas. It includes pre-diabetes. About 90 million people here in the US have pre-diabetes, so we see that as a significant opportunity. Gestational diabetes is another growth area. Remote patient monitoring in the hospital at home, monitoring patients post-discharge, and health and wellness applications. So for performance optimization, understanding how diet, exercise, even sleep or stress patterns all affect your metabolic health in real time. And many folks ask, what is our motivation for doing all of this? This is a nice collage of some of our patients and our Dexcom warriors. Many of my colleagues actually in some way have been touched by diabetes. They might have diabetes themselves or a loved one has diabetes. And this is truly what motivates us every day as our patients. And personally, having a family history of diabetes and having limbs amputated and blindness run in the family because of diabetes, I go into work every day knowing that we're optimizing health outcomes for the society at large. And that's it. Thank you.
Thank you very much. We have time for questions. And did you want to share a DEI story?
Sure, happy to share a DEI story. One of the core tenets of Dexcom is to serve our community and reflect the makeup of our community. At Dexcom, over 1/3 of our leadership positions are actually held by women. And over 2/3 of our workforce identifies as either ethnically or racially diverse or minorities. So it's something we take very near and dear to us at Dexcom.
Fantastic. Thank you. We are going to do Q&A. Jason's got one, but I'm going to, John, you want to run the mic to Jason? While we're doing that, I'll ask you, how does it work? What's happening in there in the skin?
So
once you stick it on?
When I apply a sensor, a small wire less than the diameter of a human hair actually goes just slightly under my skin. There's a chemical reaction there that takes glucose and produces an electroactive product that I actually detect by a redox current at this electrode. And integrated in here is a complete microanalytical system that takes that current and converts it to an actual glucose reading in real time. So it's a very sophisticated system, kind of underneath of a veil of simplicity, as you can see.
Yeah, so I've heard for decades that non-invasive glucose monitoring is really hard. You said that son of the woman you met on the plane used, I think you said, a Dexcom sensor 10 years ago. Can you comment on what that sensor was like 10 years ago and like what the performance was like and what the limitations were and how that has changed over the last decade?
Great question. So our sensor has changed significantly over the past 10 years. I'll start with the way it's applied. Today, it's an auto applicator, again, 3 steps. 10 years ago, it was a multitude of steps where you actually would have to inject yourself with an applicator device. So you would actually have to insert and then remove the cannula and clip in a transmitter and actually have to do many, many steps in order to get the system to connect the phone. Today, our entire system is a disposable. So gone are the days where you actually have to reuse a transmitter. Gone are the days where you have to go through this long process of unpackaging and applying a sensor. So that's one overt way. The other way is accuracy. Our accuracy has improved considerably in the past 10 years. It's a function of improving the way that we make our sensors, but also gaining an additional level of understanding about the interactions of our sensor with human physiology and developing some very intelligent algorithms around that. So that's allowed us to maintain our position as the leading provider of accurate CGMs on the market.
Thank you. I have a question over here from Martin.
Thanks, Josh. A quick question, Martin Peacock from Zimmer & Peacock. Is there a future for true non-invasive photonic CGMs? And does it work?
I get that question a lot. You know, non-invasive CGM has always been that thing that's always 5 years away. And one of the challenges that you find is that glucose, like most other organic molecules, only have a spectroscopic signature that's unique, a molecular fingerprint in the mid-wavelength infrared band. And we can't necessarily make good integrated light sources at those wavelengths, nor can we make good detectors at those wavelengths. Actually, if you were to look at what's required, would be something that would sit on a large optical bench and take hundreds, if not kilowatts of power. So, you know, technology changes at a breakneck pace. Will we see it? Perhaps. But today, optical and photonic sensors just can't match the low cost, the high performance, the robustness that electrochemical sensors can offer.
Hello. Actually, my son is a type 1 diabetes and he's using Dexcom. So thanks for
All right.
my life a little bit easier. I have tons of questions. I could have like a meeting together, but I'll stick with maybe two quick ones. You mentioned that you're working with insulates. So, but I'm following that very closely, as you may think. It seems that you're not talking to them for the Omnipod 5. Is it true, or does it change or something? It would be really nice to have like back and forth feed forward with the Dexcom and the Omnipod 5.
So that's in the works. Of course, we take that seriously, and we do think that our partnerships with the insulin delivery companies are one of our competitive advantages. And again, towards a future of reducing the barrier of diabetes management, that's really aligned with our future. So it's coming.
Yeah, I'm with you on this. And well, since I have you, let me ask you one question from a user. Maybe you can explain a little bit better. The major problem I have with the Dexcom, we're still having a Dexcom G6 because we're in Canada, still waiting for the G7, is the compression lows. Or actually, I'm not even sure it's compression, it's probably shear. My son is very lean and we have a lot of false reading.
Yep.
Do you have like insights? You can explain a little bit how it's working too. It can be a nice opportunity, but I'm just wondering if you have anything to say about it, how it's working, how we can make it better, or maybe the G7 is better on some aspect of this.
So yes, the G7 has some improvements. Compression lows are something that we're acutely aware of, and we have research programs in these areas. Certainly something that still challenges CGM today and something we're working towards. And happy offline to discuss with you some of the ways that we've been looking at it, and would love to hear from you and your experience with how these impact overall use of the device.
Well, thank you so much. Let's thank the speaker.